My name is Noari McGowan, and today I will be going over community health promotions for the health issue of vaccinations. Mission City Community Network is a great resource for the people of Victorville, California to access healthcare needs. We have 2 locations in my place of residency. Both locations offer the same services at no cost to the uninsured and low-income families. Their hours of operations are Monday through Saturday from 7 a.m. to 5:30 p.m. Their clinics are staffed with family practitioners, internists, psychiatrists, psychologists, mid-level providers, laboratory specialists, patient education specialists, outreach staff, and clinic support staff enough to meet the needs of each service area population. In this slide, there is an image of my local public health service building, which happens to be the San Bernardino Department of Behavioral Health. Their hours of operations are Monday through Friday from 8 a.m. to 5 p.m. These services are provided to those with low income or uninsured. They offer a multitude of services, everything from health, disaster preparedness to animal adoptions and care. Public health services are available at the county and state level and not the city level at this time, unfortunately. At this time, I feel like my local public health offers everything my community needs to achieve a healthy lifestyle. This site also covers my health issue of access to vaccinations. The report, which summarized vaccine coverage and exemption estimates collected by state and local immunization programs for kindergartners in 49 states and the District of Columbia, as well as data on kindergartners provisionally enrolled for 28 states, also said vaccine coverage was 94.3% for the 2 doses of measles, mumps, and rubella vaccine. According to reports from 41 states and the District of Columbia, coverage was 93.8% for the 2 doses of varicella vaccine. The good news is vaccine coverage rates for all 3 of these immunizations increased compared to the previous year's data. The bad news was that the median percentage of kindergartners with an exemption from at least 1 vaccine increased slightly for the 3rd year in a row to 2.2%, and the median percentage provisionally enrolled or attending school during a grace period was 1.8%. Although vaccines among children ages 19 to 35 months are considered high, it was noted that children were less likely to be up to date on these vaccines. 2 or more doses of the Hep A vaccine, those came in at 59.7%. The combined 7 vaccine series, this is going to include 4 more doses of the DTaP, 3 or more doses of the polio virus vaccine, and at least 1 dose of the measles-containing vaccine and the full series of the Hep B conjugate vaccine. These came in at 70.4%, and the rotavirus vaccine came in at 73.2%. Coverage for the Hep B birth dose was also low at just 73.6%. In addition, the CDC noticed that among children in this age group, coverage for most vaccines was lower in the uninsured children and those insured by Medicaid compared to those with private health insurance. The agency also noted that disparities were larger for vaccines that required a booster dose in the 2nd year of life. Despite previous data from the National Immunization Survey that indicates the percentage of children who reach age 2 years without any vaccinations has increased gradually from 0.9% for children born in 2011 to 1.3% for children born in 2015, CDC officials remain confident that most children continue to be routinely vaccinated. For families with no health insurance, children can be vaccinated at the local public health department or community clinics such as our Mission City Community Network. This slide goes over disaster planning for Victorville, California. As far as regarding how my community has prepared, the local fire department comprised safety tips for families to enact during disaster, which can be found on our public health department's website. Where do we go? Per this website, unfortunately, it doesn't list where to go. It states during the emergency to listen to the local radio station for guidance on where to go during the event when it occurs. It also stated that the usual places of evacuation are typically local schools, hospitals, and community centers. The information presented on this slide was taken from the disaster planning website, and it basically covers what to do during the crisis. Here are some images of billboards that are scattered across my community that go over health education and promotion in Victorville, California. These images are brochures and flyers I found that go over health education and promotion in Victorville, California. In these images, I wanted to demonstrate how my community, Victorville, California, is really big and supportive of the nursing community. The next few slides goes over community engagement within Victorville, California. This first one shows our local farmers market and how they promote through fresh organic produce for a healthier lifestyle, typically by taste testings. They also have several essential oil booths that promote optimal health, and they usually provide samples as well. These images show how our local hospitals create awareness for primary care. Typically, it's promoted via free community health screenings done on hospital property. And when they conduct this, they typically give away a bunch of free stuff. So it tends to bring in more people. These are some of the city group affiliations that Victorville, California is associated with. The Wounded Warrior Projects typically do things with mental health awareness fundraisers. Route 66 for veterans, they typically provide free health resources to veterans via prescription medications with vouchers, glasses repairs for free, etc. They also do a lot of local car shows that increase access to primary care via the promotion of transportation through local car services like health transports or medical buses. All of these methods generate a huge buzz. Most of them are promoted through local radio stations, social media, signs and billboards, and word of mouth. And they are often seen with multitudes of people gathering for these events. This concludes my presentation, and thank you very much for watching.